All right. Let me present to you Lee Kim, Director of Privacy and Security at HIMSS. Or do you have to acronymize it? HIMSS.
HIMSS.
HIMSS is
You
fine.
got it. You're a pro.
HIMSS is fine. And Lee will give us the state of security for healthcare and critical infrastructure and ways to improve it, right?
Yeah, that's right.
All right. And just tell me next slide when you're ready to go.
Okay. Hi, folks. Thanks so much for being here today. Really happy. This is like the highlight of my week to be here at Peerlyst. You know, as a brief aside, you know, someone from Peerlyst had reached out to me maybe a year ago. They said, "Hey, why don't you repost your blog on getting the CISSP certification?" Thanks to Peerlyst, that's our #1 blog post, and has over 4,000 views. And that's the result of what the beauty of what you guys bring to the table. So, you know, like I said, thanks. So you guys have a link to my bio and all that, and I'll go into that. But next slide, please, Ross. So I wanted to give an overview in terms of, you know, our healthcare cybersecurity field. Well, first of all, to level set, how many of you guys are in the healthcare field? Bo, I know you are. So quite a few. So if I'm telling lies, you guys will call me out. So, you know, let's just give a little bit of a primer for those of you that maybe aren't familiar with what's happened. So for me, I was a IT tech in the 90s before going to law school and becoming an attorney. In the 1990s, you know, I worked in healthcare IT for a major healthcare facility. Our biggest fear at the time was employees snooping on medical records, right? The viruses and things like that out there were few and far between. I seem to recall what on the distro I was reading about the Malicious virus and a few things here and there, but it really wasn't anything really nasty to be concerned about. We did have IT best practices, as those of you know, backups. You know, the focus more on healthcare though was in terms of availability. In the 2000s, HIPAA came into play, and so we had a new dynamic going on with people wanting to make sure that they're complying with HIPAA, namely the privacy rule and the security rule to safeguard information.
The camera's here.
Yes. Oh, I'm sorry.
If you stand on the other side of the screen, it's better.
Okay. All right. That makes sense now. All right. In 2013, we had the HIPAA Omnibus Rule, which is the latest rendition of this is almost like a rendition of my previous acting lessons, which didn't turn out. So thank you for orienting me. So now that you guys can see me, I wanted to say that this HIPAA regime is certainly the regime that we're currently under now. Everyone in healthcare is very concerned about, in addition to Joint Commission, we're very concerned about the Office for Civil Rights and the various penalties that may be enforced against us. You know, healthcare is still very much in a healthcare mindset, in a compliance-based mindset. But a certain event happened in 2014. We're not allowed to name entities, but those of you in healthcare know this breach very well. There was a certain nation-state actor that breached a fairly large healthcare system, reaching 4.5 million records. And I remember that day in August 2014. And, you know, before that, my work, you know, previously as an attorney, had really, you know, was really useful in that, you know, we were all about compliance and contracts and agreements and business relationships like that. But when that certain breach was announced, that was very eye-opening, at least for me, and I'm sure that everyone was like, I was on the phone with our volunteers and members, and Bo was nodding his head. You know, we were all like, what in the heck is going on? And so, Bo, let me put you on the spot. What were your thoughts that day? Do you remember that?
Oh boy. Well, getting in the Wayback Machine. I think the scale was shocking, and the adversary was also shocking. But it was a continuation of a trend that this kind of put the exclamation point on.
Absolutely. And so, you know, it wasn't just simply, I mean, before that, right, you've been in the security field for a long time. The financial services sector, you know, trading trillions of dollars an hour, being very reliant on the integrity of their electronic information systems. Some of them even claiming that they've never had, ever had a cybersecurity event that they know of, that maybe their privacy and security officials are not telling their lawyers about. You know, this was our wake-up call in 2014. So the reason why I'm mentioning that is because it's barely been 5 years now, and ever since 2014, we've been more and more in kind of a alarmist, reactive kind of stance in terms of healthcare cyber, knowing that hackers are out there. And I don't mean just simply, you know, the script kiddies and people that just run exploits with very little modification to code. We're talking about people that are very sophisticated, that may be gray hats or black hats, that may not even mind doing harm to patients. So next slide, please, Klaus. Currently, so what's happening? Like I had mentioned, we switched from that compliance-based mindset to a risk-based mindset, or at least that's what a lot more healthcare organizations are doing. And so as a result, you know, we're concentrating a lot more on risk assessments, and even larger healthcare organizations actually have playbooks in place in terms of what they're going to do in case of maybe CRD, ransomware, or otherwise. So we have that going on as opposed to a checklist approach where security is kind of an afterthought deep within the bowels of the hospital system. That said, you might ask, well, you know, I get that healthcare is a little bit more awake to these threats and everything. We certainly hear it on the news. I mean, pretty much every American nowadays knows a little bit about what hackers do and what they, you know, all the oohs and ahs that's in the media. But, you know, the bottom line is that in the healthcare and public health sector, you know, those of you in healthcare, let me know if I'm being honest here, but a lot of folks still have their head in the sand. We might information share with our peers locally or regionally, but we really aren't sharing information with the government. We might not necessarily trust the government. We might not be sharing information with other sectors, and that in itself is an inherent limitation. What's more, we hear this frequently from our volunteers, but it's true. The cybersecurity culture in terms of accepting the cybersecurity program and not requesting hundreds, if not thousands, of exceptions to your program. A lot of organizations still struggle with this, and hospitals in particular are doing business as usual, where cybersecurity is just simply not at the forefront, and the cybersecurity personnel don't get the support that they have to. And what's more, when there's a very big breach or other incident, let's just face it, a lot of the CISOs lose their job. So we need to change that. So, you know, with that in mind, again, I don't mean to throw healthcare under the bus. I think that we're making great strides, don't get me wrong, but I think we have a long way to go. And for people that we know in the field, you know, they'll say that healthcare is behind 5, 10, you know, at least 5 or 10 years behind other sectors. Next slide, please. So that said, I'll give you guys actual data points. Each year we have an annual HIMSS cybersecurity survey, and we actually had our 2018 HIMSS cybersecurity survey, and so this is essentially our 10th iteration. And you might ask, well, who took the survey? It really was a collection of folks. Was executives that you know, actually have oversight over security programs. It was folks that are maybe, you know, non-management folks. It's also, you know, folks that are you know, maybe analysts and some such. So pretty much we had a pretty good slice of people Slightly more executives, not the non-executive management, but management were primarily the survey takers. We had a little bit over 200 or so qualified respondents. They either had some degree of day-to-day responsibility or oversight over the program. Next slide, please, Huss. So what's interesting this year is that we asked, of you folks that had a recent significant security incident, and we left it to the organizations to define exactly what that is. But of those of you, and it was about 75.7% of respondents that had said, yes, we've had a recent significant security incident in the past 12 months. We had said, okay, if you can characterize the top 3 threat actors, who were they? So in order of precedence, they were the phishers, negligent insiders, and the hackers. Number 1, number 2, and number 3. And the most popular typical initial point of compromise, far and away, was email. Perhaps not surprising with all the interesting tools out there that can be used to send very convincing phishing emails. And by the way, just as an aside, for those of you that want the references, I'd be more than glad to share this with you guys. I am actually on a part of a research team of DHS. They have an analytical exchange program, and our project over these 6 months through end of July, we're actually looking into phishing, and wouldn't you believe it, as part of my research into that, we actually discovered that there's actually patents available in terms of automated spear phishing. Of course, you can patent a methodology. So, and what's more, the patent that I recently located that was about in the 9 million series, it leveraged AI techniques. So if you think that it's bad now, it's going to be bad tomorrow, for sure. Some more reasons why healthcare is doing better, but we need to do much better than we are today. 45% of our respondents are pen testing, which is pretty good for healthcare. But of those respondents, only 1/3 of those are testing their phishing awareness of workforce members. So that kind of is shocking for folks that do pen testing professionally, because that's one of the main things that they may do in addition to testing physical security defenses and otherwise. And what's more, security awareness training, if there's a plus in healthcare, we're doing a lot more security awareness training, but it's happening just not frequently enough, about once a year. Only about 1/3 of folks are doing it more frequently, such as mainly once a month. Some do it daily, but again, wouldn't it be nice if we had a screensaver that said, that had some kind of best practice tip in terms of what you should be doing, or maybe what you shouldn't be doing? That certainly would be excellent. Again, I believe that the once a year is a relic of the Meaningful Use program. You have to attest to, security awareness and risk assessments and all that good stuff. But let's just face it, how many of you remembered what you had for breakfast 1 year ago? That's kind of what security awareness training is for most folks. So next slide, Klaus. And what's more, just wanted to say how little money we have to spend on cybersecurity. 6% or less of the IT budget is typically carved out for healthcare cybersecurity. So what in the world can you do? Maybe buy 1 or 2 solutions, but especially if you're a small or medium guy, you can't really afford much. Although I could tell you that one of our volunteers on our committee is with Yuma District Hospital. They're a town of 4,000 in Yuma, Colorado. And if you want to know about a critical access hospital that really has it together in terms of their security program, talk to Jason Hawley at Yuma. They really know what they're doing, and they're really leveraging what they have on a shoestring. That's a very powerful lesson. We also have Bayardo Alvarez with Boston Pink Clinic. And they're also leveraging their IT wherewithal and a shoestring budget, but they're doing pretty well in terms of their defense in-depth approach. Some other findings from the survey: the Nist cybersecurity framework is the #1 framework that folks are following, followed by HITRUST and ISO and others. It's kind of interesting to me because, Nist, certainly a lot of folks have at least heard about it. Some are implementing it. We actually have our cyber call to action, which actually calls for the implementation of it since there's more traction around it. But would you believe that in terms of security frameworks, almost 1 in 5 folks of our respondents have no framework at all? So what are they doing? Probably HIPAA, maybe HIPAA, who knows? But that's what's happening. So that's why I'm saying we definitely need room for improvement. And boy, I remember attending the 5th Nist cybersecurity workshop in Raleigh, Durham. And I remember there was a fellow that stood up in the audience that waved his hand and he had said, "Who's ever going to adopt this? This might be actually a mess." But thank God that was actually a premature concern. We actually have more traction around it, but in healthcare, it's especially because Nist certainly is pushing it, and the Office for Civil Rights and other civilian agencies are pushing it as well. One thing to know about cybersecurity threat intelligence from the healthcare standpoint, there's no clear winner. Our HIMSS members, of course, look to our resources, but US CERT even is not very well utilized, and it's free. Only 1 in 4 of our respondents say we look at US CERT in the bulletins. And anyone can hop on that mailing list. ICS CERT, it's about the same number as US CERT as well, about 1 in 5 respondents. The good news in terms of findings from our 2018 HIMSS cybersecurity survey is that about 3/4 of folks have insider threat programs, but less than half actually have formal programs. So what does that mean? I mean, what if you have someone snooping medical records? What if you have someone that lost that laptop? What do you do? The bottom line is if it's informally enforced, everyone knows here, unless you have a formal program that's clearly and consistently enforced, your security program will look like Swiss cheese and it'll be like a total SIP. So what is the point is that it's good that it's there, but again, I think that healthcare has yet to wake up to the importance of insider threat, unless, of course, there is an incident that had happened, such as medical ID theft or fraud or something else that had happened where, let's say, it's as an example, an IT employee that was fired, they still had access wasn't cut off in time, and so maybe they set off a logic bomb, maybe they did other things to make sure that the rest of the IT guys were in pain for a week or a month. So that said, I wanted to point out one thing here, and again, for those of you that know me, I'm not just giving this presentation just to give a presentation. I'm here to help for those of you that are in healthcare. Any contacts that you want, any research, any connections you want to anyone, I'm here. I'm here for you guys. I'm part of the Peerlyst network for a reason. I'm not here just simply to put a line on my resume. I'm here to give back to you guys. I really care about this stuff because I fear personally that one day, and many of us in healthcare cyber, fear that one day that, it'll be out and out cyber warfare and someone will unfortunately die. And we'll see really nasty consequences of what's possible with that medical device breach or with someone maliciously tampering with someone's health information. I mean, let's just face it, there are a lot of bad things happening in the world today. What about our patients and the people that depend upon us? So, I am a nonprofit professional, but mostly I'm here because I care about this stuff and what might happen at the end of the day to our most vulnerable populations, our patients. So that said, I would like to offer any kind of references or research that I have is yours. I'm always happy to be responsive and send out information. As an example, insider threat programs, those of you know the good work of the CERT Coordination Center and their Common Sense Guide to, insider threat management. But certainly we had a counterintelligence guy out of FBI Boston that had given a presentation to our healthcare security forum. And he actually said, here, you can have these slides in terms of detecting malicious insider threat. And here are the indicators that we see in terms of someone that might be potentially an insider threat actor. So it's stuff like that that's available on our HIMSS website that, like I said, whether it's now or afterwards or in a month or in a year. My email address is at the end of the slide deck. Please contact me. I am more than happy to help because we're all in this together. And regardless of whether or not healthcare is your field, we're all patients one day. And for all of you that are in the field, you know how powerful and how important information security is, even if the business guys might not. So that said, you can read the rest of this in terms of what's going on with risk assessments and everything, but we're making some progress, but not nearly enough. Next slide, please. So what are our concerns for the future? Essentially, we're concerned still this day and age, oh my God, am I going to have a breach? Am I going to have data leakage? Is that consultant that I hired going to accidentally hire or post PHI to the web with thousands of patients? Those things happen. So we're most concerned about breaches. Credential stealing malware is certainly a concern. Sometimes it gets bundled with ransomware, as you guys know. Those are the top three. Wiper malware certainly made the list, and so on and so forth. But those of you that may want to get this survey, it's available at www.hims.org/HIT-security. Future priorities. What are we concerned about? Just about everything. And just about all the different major focus areas of information security is listed there. But of course, disaster recovery, business continuity, risk assessments, incident response. Those are our top priorities because we're constantly blocking and tackling. Next slide, please. So let me just top it off with one additional finding. So, I am actually a part of a group that's based out of DC, a group of nonprofits called MOFI. It's the Multi-Association Framework Development Initiative. It's open to nonprofits. We represent about 9 different critical infrastructure sectors. So kind of as a result of being inspired by MOFI, which is headed by the IT Industry Council and US Telecom, I thought, okay, healthcare folks, what are you interested in? What are you concerned about or worried about in terms of failure or disruption of other critical infrastructure sectors? So what I did is that I placed a questionnaire survey that essentially asked, okay, based upon the NIP, there are these various sectors, manufacturing, water, electrical, whatever. Based upon the NIP and these dependencies that we have, the National Infrastructure Protection Plan, which sectors are you most concerned about failing or disrupting? And the answer, first and foremost, was ICT, perhaps no surprise, don't fool with my internet. Without my internet, everything's gone. And the secondly, was the IT sector. Keep my IT assets rolling. I don't want any disruption in the supply chain. I don't want anything to happen in terms of supply chain integrity. Those are the two things that we're concerned about. Everything else, like even emergency services, we're very closely coupled with that, of course. But is that really our top priority? Not really. Electrical, water, other things. Are we concerned about that? Not as much as don't fool with my internet, don't mess with my IT. So I think that that's room for improvement in terms of healthcare and needing to learn about other critical infrastructure sectors and information share. Because frankly, if you aren't paying attention to what's happening in finance or electrical or water or other sister or other sectors, you're missing the boat and you're missing the opportunity and potentially some predictive analysis around what's coming down the pipe for us. So next slide, please, class. Some notes from the field. This is kind of inspired by some research papers that I've been looking at where they kind of give anecdotal notes from the field. I thought this would be interesting. Those of you in healthcare probably would nod your head. Yes, phishing is a really big problem. When I proposed to the DHS team, let's work on phishing, they were saying, really, it's so basic. But the more healthcare folks that we spoke to, the critical access hospitals, physician practices, major hospitals, they all say, yes, phishing is absolutely a problem. In terms of threats that are happening in healthcare, we can't say that each day is the same. Actually, each day is very different. And so, there's alert fatigue and people feel like it's essentially like whack-a-mole. It's different day to day. Medical device security. The press might make you believe that medical device security is very important. Yes, it is. But there are actually a lot of folks that say that we're getting so much focus on medical device security. A colleague of mine that's an ethical hacker would say, there's too much focus on this. Any hacker would likely get in through endpoint or some other weak access points. Just about everyone in healthcare says our number one concern is patient safety, at least those that I speak to. We had a private information sharing roundtable at our annual conference, and one of the best points that came out of it was from a privacy professional that works for a major healthcare provider in the Northeast. And she said the privacy folks don't know security folks don't know privacy. So the privacy folks might know stuff about HIPAA, GDPR, breach notification, compliance, all the best practices dealing with privacy, data provenance, and all that. Security folks might not know privacy. So this point I could say is true based upon at least my experience when I was in private practice for 10 years. I would frequently counsel clients in physician practices, and they'd oftentimes have a breach. That's when the lawyer would come in, and more often than not, it would be a technical kind of breach resulting from some kind of cyber attack or cyber compromise. And quite frequently, I'd be on the phone with the privacy officer. The privacy officer would try to filter through these technical details in terms of what's happening in terms of this cyber incident. Do you think it was a very pleasant or well-informed conversation? The answer is no. Unfortunately, we generally would lose about 1 to 2 weeks until the security officer got on board and we could talk apples to apples. Unfortunately, that typically happens if you don't have a good playbook or plan in place in terms of who's going to do what, in terms of if it's a privacy problem, security problem, you lose valuable time. And finally, last but not least, our end users are our number one threat, hence the focus on cybersecurity awareness. So those are a sampling of the findings that we've seen. Next slide, please, Klaus. Advanced and critical infrastructure. So those of you know this, right? Critical infrastructure's definition I pulled from EO 13636. I think in terms of healthcare, healthcare is important in terms of our welfare, our public health, our safety, our national economic security is such a huge portion of the GDP, and our impact on security. Without healthcare, how can we be well? How can we be safe or functioning as a nation? Everyone needs healthcare. Healthcare touches everything. It touches everyone in this nation. So, there's that. And so healthcare, of course, is a little bit special compared to other critical infrastructures. Some critical infrastructures are under the guidance and oversight of DHS. With us, HHS is our sector-specific agency. So we are always paying attention to what HHS is saying, either from the ONC side or from the OCR side in terms of enforcement. And next slide, please, Klaus. So, as promised, I wanted to talk about how we could advance the security and stability of critical infrastructure sectors. Number one, everyone in this room probably knows this. Cybersecurity, we're so specialized. It's even more specialized, I think, than law. You may have one person that may do incident response all day, but they might not really have a broad, expansive view of cyber. Point is, I think we all know this. That's why we're attending things like RSA. That's why we're here at Peerlyst. The beauty of the kinds of information that you guys share through Peerlyst is you are on top of the top threats. You see what's happening across sectors. We need to replicate a Peerlyst-like approach across other sectors, across in every industry, every organization where we are sharing information. We trust each other. We may sometimes disagree with each other, but we aim to always share the best information with really bright and talented people. Some of you in the room I've worked with, and I can attest to that very fact. So, get outside of your comfort zone, share information with colleagues, even in other sectors. Sometimes you may want to just have a frank discussion with a colleague who you trust and say, what in the hell is going on? And it's true, especially whenever we hear about, ransomware strains and other things. Sometimes you just pick up the phone or, text messaging or whatever people that are a little bit more modern than me do nowadays. And you say, what is going on? What's happening? Can you share the threat indicators with me? Can you share your communication strategies in terms of telling your people what's coming down the pipe? What's been effective for you? What works? Never forget the importance of these soft skills and the human in the equation. So I won't read all these other things, but certainly it's really important also in the wake of NotPetya and want to find other things, understand what your dependencies are. Know that the internet might not actually be accessible to you next month, next year. What's your backup plan? What are your strategies? How do you know that the upstream manufacturer, and I'm kind of distilling down some things from some previous conferences last year I've attended, how do you know that that manufacturer that's using an integrity checking tool on certain software that's being used to make your product, how do you know that manufacturer that makes IT equipment who's using an integrity checking tool that's certainly good because everyone uses it and gets from some dude, how do you know that that's actually something that's legitimate? So there are a lot of problems, a lot of questions, but we need to up our game a little bit in terms of seeing what's out there and questioning our assumptions. Any good analysts, I know that we have a OSINT talk happening a little bit later on in the week. Any good analyst knows that just because you have information doesn't make it true. And whenever you get information, you always have to ask, is this actually true? What's my reliability as a source? What's my level of confidence? Can I get a three-way confirm on this? What are the academics saying? What are people outside my sector saying? Is there some kind of concordance in terms of the information? That's kind of the magic behind intelligence analysis. I mean, yes, techniques are very important, open source and otherwise, but everyone here at some level, at some point in their careers, if not now, is in a way an analyst. We get information, we hopefully have enough sophistication to know what may be fake news, what might not be legitimate information, what might be legitimate information. And sometimes we don't have access to that raw information, we rely on that finished intelligence, but it still behooves us to be cautious in what we're seeing because I hate to use the term fake news, but there's a lot of misinformation out there, and especially when there's a new incident that breaks. There's a lot of confusion, and people confuse one malware for another, and people have flaming debates and everything else. Certainly, for those of you that haven't been through it, I would totally recommend that you, look into getting further training in terms of analysis, because that will, once you have that will really aid your skills as a researcher, professional, blocker, tackler, whatever it may be. And last but not least, pay attention to academic research and scholarship. One of my there are some folks that I know in the field that are just light years ahead of a lot of folks in the field, John Song, Avery Perrig, and others who have a vision for a more secure internet. And our industry, it takes us maybe 5 or 10 years or sometimes longer to catch up to that, to see, oh, okay, that's perhaps what we should be looking at, or perhaps what we may be doing in the future. So just wanted to say that just because it might not be on the show floor at RSA, just because you might not be attending the same conferences these folks might, some academic research and scholarship certainly has some visionary perspectives. So those are some of my thoughts in a nutshell. And resources, you guys will get these slides, I think. These are some slides that I have. We have monthly cyber reports, and I pulled out some resources that we've distributed through those. It's totally free. You don't have to sign up. There's no salesperson that will call you just for downloading our report. But here are some highlights from some of these reports. Next slide, please. We also have free education for folks interested in healthcare cybersecurity. We have webinars. We have a webinar coming up on third-party insurance and risk management by a speaker from HITRUST. We have Kevin Johnson from Secure Ideas talking about how you can leverage ethical hacking to help protect your own organization. And we have, a pretty popular webinar. We have about 12 months worth of old webinars, but we just had a webinar on GDPR, and we'll likely have additional offerings. And last but not least, we have our cybersecurity podcast called Code Red. So certainly, we have kind of a mix of resources and things. So I think that's pretty much it. And we have additional resources here. Just one last thing to note as well. For those of you interested in security awareness training and tip sheets and whatnot, you can access that second link there, and you'll see what we've done in terms of privacy and security awareness training. We've essentially worked with the National Cybersecurity Alliance for the past 5 years, and we'll continue to do that. And so if you want to help your organization be more secure, or help your end users be more secure, then you may want to partake in some of those materials. I think that's about it, Klaus.
It is.
That's it. Questions? Anything? Thoughts? Comments?
I just wonder, you mentioned a couple points, right? Points about your largest enemy is like your end user, right? That was
Yes.
one line. And definitely it's an awareness issue, and we also mentioned about the sector is not against cybersecurity aware, right? The culture is not really there.
What is there?
Is it mainly through education? Are there like targeted kind of efforts that you would suggest to address that?
So, again, let me give you some notes from the field, that kind of perspective. So it's interesting. Anecdotally, the folks that I speak to from providers on the East Coast, they're like, I don't know about the security awareness thing. I'll do it once a year, but I'm a lot more heavily reliant on technical controls. That's typically what I hear from folks on the East Coast. They're a little bit cynical about the security awareness thing. But on the other hand, and I mentioned this, and it's public info, we reported it, it's on record. As an example, security awareness training for even a critical access hospital. I mentioned Jason Hawley, who's essentially head of information services and head of information security at Yuma District Hospital Clinics. They are pretty much the only game in town for hours and hours, and they have many end users there and pretty small IT security staff. Through training, they were able to achieve 100% rate in terms of effectiveness and people not falling for phishing scams and emails and whatnot. So that's not really West Coast, but I could tell you that as I travel and I give talks to folks, West Coast folks seem to be willing to work a little bit more with human factor. They seem to be a lot more receptive to security awareness training and the effectiveness of that, and a little bit more positive. They're a little bit more lenient as well. If there's an incident, they're less apt to, throw the book at them, so to speak, and sanction them or do something evil. They're more for re-education, and I think that's the plus side of the West Coast culture. East Coast side, on the other hand, they're more apt to sanctions and things like that. So I'm not saying it's be all and all, for the West Coast, East Coast, there are these differences. But I can tell you culturally, as a person who's spent time on the left coast and the Great Coast, I'm originally from Berkeley, so I'm a California kid. So I get it. So I'm not just saying this just based on my nonprofit career. But folks on the West Coast, we're more friendly. Folks on the East Coast, we're a little bit more guarded. We're a bit more like, I don't really trust a human. But I think that, security awareness training is at least worth, trying to up your game. I mean, what do you have to lose? Really, truly. But incidentally, there are more folks on the East Coast will say, you know what, there are people that want to ignore my training, there are folks that want to work around my training, there are folks that want to give me a headache, there are folks that want to so sorry, I'm from Pittsburgh. I don't need to throw Pittsburgh folks or other folks under the bus, but we're a little bit more cynical though. So I hope that answered your question. Anyone else? Oh.
Go ahead.
My thoughts on this is there's kind of a movement, at least a small one, to just, as you're saying, most of the incidents are in-user incidents, to just remove the user from the security equation. So there are solutions like, I'll just throw one name, Trustana.
Okay.
They do their hashtags, no more passwords.
Yeah.
The user doesn't have credentials. Right? They have a device, either a phone or some other device, and that's it, right? So if you lose your device, it's turned off. If you're fired, it's turned off. But you don't have credentials. You have anyone, no one can fish you, no one can scam you. But take the credentials, of course, but that's a different problem.
So nothing is that solution to that company, but one of the fascinating papers that I had uncovered when I was putting together our last monthly, cybersecurity report. It's a really wonderful paper, and it's accessible at hims.org/cyberreport, or you can email me and I can send you the actual link to the paper. But there was a wonderful paper called The Malicious Use of AI. And I'm not sure, again, not to throw any solution under the bus, but there are always ways to trick the machine.
Sure.
And one of the
It's way harder to trick the machine than it is.
It could be, but I have to say this. I mean, it's a 100-page paper. I did not study in great detail, but one of the profound statements in it that was kind of chilling to me was that machines will make mistakes in ways that humans never will.
Yeah.
Yes.
Amazing.
Vice versa.
Interesting.
Totally
Interesting. Yeah. So if there were a human in the loop, would that machine make a mistake? I don't know. Go ahead. I'm sorry.
No, I just think it's like you said, vice versa. It's an interesting world.
Brave new world.
Great. Oh, right here.
Great presentation. Your enthusiasm is really contagious, and I learned a lot.
Okay.
We're seeing in the news recently some really large organizations like Facebook struggle with API security. In healthcare domain, you have the FIRE initiative, and people are starting to open up all the digital assets in the form of healthcare records to other organizations, to other hospital chains, to other teams. These new attack vectors, APIs. How are you seeing healthcare entities deal with that today? Is that something that people are starting to think about? He's
laughing.
Yeah. So I'm not an AI expert, but I could say that we do have a staffer with HIMSS who, his name is Adam Culbertson, and he's very much on projects such as dealing with fire and things of that nature. But that said, we haven't done a survey on it, nor do I have a lot of data points on it, so I'll just give you an off-the-cuff reaction based on what I know today. Basically, I believe that healthcare's stance or perspective, the normal, aside from notwithstanding the researcher or security problem, the normal reaction to APIs is the kid blockchain. It's a silver bullet. Oh, this is awesome. Yeah, we need to open up the channels, right? So I don't know. Did you have any additional thoughts on that?
I'm just my thought is what I've seen is, I mean, you see generally across healthcare, security is like the afterthought of the afterthought of the afterthought.
It's a step down.
Yeah. So I don't have great faith in the security of these things. I mean, it works, but I don't have great faith in the security.
It's grim reality.
I appreciate that. Thank you.
Yeah, absolutely. I don't know if there are additional questions, but like I said, I am more than happy to share references, research, contacts, whatever I have that I could share across. More than happy to do so. You have my email address. Just let me know. Thank you.
Thank you. The good thing about Dee being on Peerlyst is also if you find or think of questions for her later, you can ask them on there and she will respond. You're also welcome every time you have one of those webinars or podcasts to post links on Peerlyst so that the community can find them.
Will do.
Also, I have one small funny detail when it comes to security awareness. Something I did in my previous job was the absolutely most effective thing I ever did for security awareness was to take like a cheat sheet for security awareness and put it right in front of the wall when you're sitting, when you're on the toilet. Every one of my colleagues read it at least 1 million times. It just works. They just knew everything. Then they just needed to put it in practice, but it never left the top of their mind.
Amazing.
Ever.
Never heard that one. Thank you, Klaus.
Thank you very much.
Okay.
Thank you.